some other stories now. Today is World Patient Safety Day, and issues of access and quality largely contribute to ensuring patient safety. President of the Coalition of NGOs in Health, Dr. Gabriel Benaku, is my guest for a conversation on this subject. Thank you very much, Doc. It's a pleasure to have you here. So when we started the bulletin, we shared a story from the Volta region, somewhere where over 14,000 people have access to only one health facility with only one doctor. We are here today in Damba, in the OT region, I beg your pardon. We are here today celebrating World Patient Safety Day. How do we ensure safety in this kind of situation?
Yeah, thank you, and good morning to people who are watching you and listening to this program. Yes, that is why Ghana is continuously developing the policy over the last 20 years. We need to address that. And we keep on telling government that they need to do something about it. If you look at OT and the 6 regions, that is the Bono East, the Savannah, the Northern region, the Northeast, the Upper West, the Upper East, they are very much vulnerable, and Western North. These are the regions that we need to really do something about it practically. They are mostly affected by inadequate doctors, inadequate nurses, and even more importantly, they do not have standard district-based hospitals. And if we want to ensure safety of patients, we need to have a universal policy and really implement the policy to ensure that every district have a district hospital. We need to ensure that nurses are placed at the various CHIP compounds. Community health nurses and other paramedical teams are supposed to be accessible at the primary level of health service delivery. Most of the issues we deal with at regional hospital are actually supposed to be dealt with at the district and even polyclinic level. But because we have not equitably provided infrastructure and human resource, people have to struggle to move from primary, secondary to referral facilities. And that also creates more pressure there. So the specialists who are supposed to work on special cases tend to just deal with normal malaria cases. And they get overwhelmed with the cases, and therefore they get frustrated. They could make some mistakes. And we have seen over the before COVID, we used to have almost every month, we have alleged neglect, medical negligence cases. That tells you how our health system is overstressed at the secondary and tertiary level.
Doc,
we want to take this opportunity to encourage the 2 major political parties in these difficult times to really come out with pragmatic and practical manifestos that can really ensure that there's universal access to healthcare at the barest minimum level.
Doc, it's interesting you mentioned fatigue as a factor in patient safety, because when a doctor is stressed and tired, then they're likely not to do what's best for the patient. There are 4 objectives.
No, they even make mistakes. They can make mistakes.
Yes, there are 4 objectives for this year's World Patient Safety Day. One of them is to create awareness about safety for health workers and how it links or translates into safety for patients. Do you think that we pay much attention to safety for health workers as we do for patients?
No, even health workers. I have researched over the last 6 years with health facilities. I've collaborated with specialists in health facilities. I've worked with the Mental Health Authority over the last 10 years. And what I do know is that even health professionals get depressed. And sometimes they are not even aware that they are depressed. And they just need to talk to a clinical psychologist, they need to talk to a mental health officer, they need to talk to a psychiatrist to also provide some services to them. And that issue is a major issue in Ghana. You see a lot of health professionals, but they do not have mental health knowledge, but they are not ready to seek for those services. So we are taking this special day to remind them that people who are trained as mental health officers, psychiatrists, and clinical psychologists also have that special eye and skill that can help them to cope with stress, anxiety, depressions, and for them to be able to do their work well. Because every day they get stressed up in their workplaces due to inadequate human resource, due to inadequate facilities. So they are forced to do so many things at the same time. The other issue I would like to talk about is accident cases. We actually need a psychologist or a clinical psychologist who should be part of the National Ambulance and Paramedics team to provide psychosocial therapy during accident, to provide interventions that can really calm down people when they are affected by accident, including families. It has a major effect in our healthcare service delivery. The other point I would like to talk about is our inability to fund the mental health authority adequately so that they can be found in every district and they can provide major education to health issues that people get stressed up. They can provide psychological medicine to reduce pressures at the various health facilities. It's very important for us to do that.
Doc, one of the reasons celebrating this year's World Patient Safety Day is very important is because of the coronavirus that has hit the world over. Now,
yeah,
like I mentioned, it's World Patient Safety Day, but the WHO, due to what coronavirus has created, has decided to also focus on the safety of health workers, and it's actually urging all to speak up for the safety of health workers, because that also directly translates into patient safety. As we commemorate the day, you've made a call to the major political parties, but let's look at the entire system and stakeholders as a whole. What would your desire be in speaking up for the safety of your colleagues and yourself?
Yeah, one critical thing I would like to talk to social workers like me and medical sociology like me and others is for us to advocate for improved health systems in the country, including human resource deployment. The other point I would like to talk to my colleagues psychologists is we need to have more clinical psychologists in all the districts in Ghana. We have very few. In fact, we have very, very few. So we need to work out to advocate.
Hello, Doc, are you there? Oh, too bad. We were just getting Doc's thoughts. Okay, I think we have him back. Hello, Doc.
For
great
clinical psychologists to be deployed in all health facilities, we need to, health workers need to speak out objectively and advocate for improved health systems in the country. And also we need to have professional health associations to be able to provide evidence by
we're losing Doc there, unfortunately, but Dr. Benaku is president of the Coalition of NGOs in Health, and we'll just take his ending comment briefly. Hopefully the line will be stable this time. Well, too bad there, but we were just discussing World Patient Safety Day, and as I mentioned earlier, the WHO has decided that the focus this year should be on the safety of health workers and how it translates into the safety for patients. And they are urging all of us to light up buildings, wear orange, do something just to show respect for our health workers, even amidst the COVID-19 pandemic.